Greetings, naturopath Eric Packer from New Zealand, author of Candida Crusher, and I'm the formulator of a product range called CanXida. Thanks for checking out my video, and thank you again for looking at my channel. Appreciate all the excellent comments I'm getting. I'm going to do a couple of videos today. One of them I'm going to call the last resort patient. When you get experience like me and you've been in the business a long time, you get a lot of people who come to see you and they say a similar thing. I've been to every doctor in town. I've been to Dr. So-and-so and Dr. So-and-so, and I've been to this chiropractor, and I went to a color therapist, and I went to a witch doctor, and I went to a medical doctor, and I went to, the list goes on and on. They could have gone to counselors, psychics, all kinds of people. And often they'll keep going around and they'll do a circuit, and they'll get referred maybe from one practitioner to another practitioner, particularly if the practitioner's had enough of these patients and thinks, well, I've had enough, just sort of move them on. So I'll move them on to someone I don't like. So then they'll think, well, we've got a list of doctors here. Let's pick this doctor here and refer the patient to that one. So it sounds quite callous, but it's true. This is quite a common scenario in practice. We get easy patients, we get difficult patients, and then we get the last resort patient. So I'm going to read a little bit of book about the last resort patient out of my book, Candida Crusher, and then I'll explain a bit about it. Do you need to drink alcohol several times a week to give you an escape from reality? Maybe you need several cups of coffee a day to give you a boost, or rely on a regular chocolate bar. These are some of the addictive patterns I see which may lead you into a path of a reliance of uppers like caffeine, or downers like alcohol, or just food in general. But it could also be a dysfunctional relationship. It could be a job that's no good. It could be some kind of a lifestyle pattern that's not very good. A patient I just had before decided finally after many years she would give up on Diet Coke. Another patient I had in England about, I think, 2 weeks ago decided she finally give up on a packet of chips that she was having 2 or 3 times per week. But she knew in the back of her mind it wasn't a good habit to keep doing, but she found it hard to give up on this one particular addictive pattern that was a recurring theme in her life. Your appetite may become disordered. Your eating pattern's erratic, and before you know it, you could have easily developed a digestive problem. Some last resort patients may take 10, 20, or even 40 different dietary supplements in the belief that they will conquer the bad symptoms inside. And there'll be a lot more on that topic, I speak about in other videos, no doubt. And then Candida comes along as an opportunistic infection, and you develop a yeast infection or poor digestive health. And then you go to the doctor looking for a solution that will generally come in the form of a 5 or 10 minute visit and some kind of prescription, often an antibiotic or an antidepressant. Problem solved, you think. But wait a minute, that's where the fun begins. You keep the underlying diet and lifestyle pattern going on, but now you compound your addictions and compulsions with pharmaceutical drugs or dietary supplements to conveniently switch the symptom off. And you begin to feel worse. And then another trip to the doctor or naturopath, and then another drug or a dietary supplement. And when your practitioner is finally sick and tired of you complaining about you being sick and tired, you'll be labelled as a difficult or non-compliant patient. And what else have I written here? I've had enough of working in the medical clinics after more than 10 years. That's when I decided to once again set up my own clinical practice and work with chronically unwell patients who've had enough of being bounced around, hopping from one doctor to another. And that's what I say to patients. The buck stops in my room. This is where the bullshit stops. When you come and see me, it's time to make the change. It's time to stop thinking this stupid repetitive pattern of trying to cure a symptom with some kind of pill or drug. It's not going to happen. Unless you change, nothing's going to change. Your mum can't make you change. Your partner can't make you change. Your boss can't make you change. Your mother-in-law will never make you change. Only you can make you change. And that's the point I'm trying to make with this video. Forget the pills. Forget stupid diets and protocols. You need to make some serious changes if you're seriously unwell. If you've been sick a long, long time, it's time to sit down and do some serious thinking about why you're not recovering. You can blame it on the weather. You can blame it on the Obama government. You can blame it on Google. You can blame it on your mother-in-law. You can blame it on anything. You've got to blame it on yourself, because you created this situation. Maybe with the help of a doctor who gave you an antibiotic. Maybe with the help of a food company that put some crap in the food that you couldn't stop eating. But ultimately, you are the person who's got that steering wheel in his or her hands, and you plot your course onto the rocks or to the open ocean. And that's the point I try and make with this last resort patient, right? So I'm going to do another video in a minute called the apple picker, and that's quite an interesting one. That's also out of my book. So if you're sick and tired of the last resort and you want to check out of the last resort, you can do that. But you need to finally pluck up the courage to have a really good, long, hard look at yourself and say, these are the habits I've created. This is the lifestyle pattern I've created. And as I've written in my book time and time again, and I tell many patients, Einstein's famous saying, the definition of insanity is doing the same stuff over again and expecting a different outcome. Insanity. Thanks for tuning in.